Hello, everyone. My name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the Massachusetts General Hospital Frontal Temporal Disorders Unit. And I'm so proud to be presenting Module 2 of the Care Plan Trifecta, person-centered care planning for every stage of life with FTD, Alzheimer's, or related dementia. Module 2 is about beginning the journey and connecting with your home community. Before I begin, I just want to remind everyone, please put your questions in the chat, in the Q&A, and we'll be happy to answer them at the end of the session. The Massachusetts General Hospital FTD Unit is a clinical research program. Led by Dr. Brad Dickerson, our team is focused on caring for people living with frontotemporal degeneration, atypical, young onset, and rare forms of Alzheimer's disease and related dementias. We're committed to providing the highest quality of care while working tirelessly towards a cure for these devastating conditions. Learn more about our program and our work at ftdboston.org. Okay, so the Care Plan Trifecta webinar series, we're going to focus on person-centered care planning. This module especially talks about what are the first steps that you should take in care planning after a diagnosis. How can the Care Plan Trifecta, how should care planning in general work uniquely for your family? And then at the end, I'll have a wonderful Q&A and discussion with our manager of Caregiver Support Services and Community Engagement, Amy Almeida. Just a little reminder, in case you didn't see Module 1, the Care Plan Trifecta is a framework to help you develop person-centered care plan that centers on the person living with the diagnosis, their care partner, and community. The Care Plan Trifecta can help you unify healthcare with personal values and goals of care. And it's a trifecta because it has three essential pillars. The first pillar is connecting with your medical community, which is what we covered in Module 1. Today, we're going to do part 1 of the home community. That is such a large pillar that we decided we needed 2 episodes to cover it. And then the third pillar is the patient advocacy community. What's most important about this framework for care planning is that you see the person living with a diagnosis and their care partner, their family, their friends, their community, they are at the heart of the plan every step of the way. I'd love to do just a little review of the medical community. So last time we talked about what are the things that the medical community can do for you. The very first thing is being with an expert provider can help you receive an accurate diagnosis. This is actually the first step in care planning to find out, what's actually causing my cognitive or behavioral changes. Once you receive that accurate diagnosis, you then are able to move over to find out, hey, what are my treatment options? What research would be appropriate for me? And then the last step of the medical community is connecting all of your healthcare providers, establishing your team. If you'd like to learn more and rewatch or watch for the first time Module 1 about the medical community, please go to YouTube and put in MGH FTD Unit. And our MGH FTD Unit YouTube channel will pop up where you can view Module 1 for free. Okay, so today we're going to focus on the home community. This is an essential pillar because we know that all care doesn't happen in the clinic. You're going to live your life alongside dementia at home, in the community where you're going to wake up every day, where you're going to have all your meals, where you're going to engage in activities that are meaningful to you. It's where you're going to live your life. Before I delve into the home community, I wanted to highlight an important reason why we talk so much about community connections. Many of you may remember in 2023 when the Surgeon General announced that loneliness was a crucial topic, a critical issue in the United States and around the world. That's why it's so important for us to talk about connection. Because after a diagnosis of Alzheimer's or related dementia, families are at a greater risk for isolation and loneliness. I say, today we may not have a cure for these conditions, but we do have a cure right now for the isolation and loneliness that may come with a diagnosis. And we're going to talk about that cure today. Okay. So when we think about the home community, there are three essential elements that I'm going to focus on. And today's module is going to talk about how do we connect in the home community as we're beginning our journey. Meaning, how do we connect in our home community right after a diagnosis or in the early stages? Maybe you're living with mild cognitive impairment due to Alzheimer's disease. Maybe you're living with mild behavioral impairment due to frontal temporal dementia or FTD. But no matter where you are starting the journey, we're going to highlight some important resources in your home community, beginning with legal and financial, moving over to local resources for care and support, and then ending with talking about love and connection. When I showed this slide to my wonderful colleague, Amy Almeida, she said to me, I really think that mountain should be bigger. Because I think that right after a diagnosis, we often feel like we're climbing Mount Everest. It can be so overwhelming thinking about what do I do first? And that is some of what we want to make easier today. So let's start with talking about legal and financial resources. This is the thing that I tell families they should do right away. We want to talk about why. Why do you need to immediately address legal and financial concerns? Well, because for most people living with a diagnosis of Alzheimer's, FTD, or related progressive neurological condition, it means that their ability to communicate, to have full understanding, to participate in advanced care planning, financial planning, to make legal decisions may be diminished as the disease progresses. So, what we want to do is encourage families as soon as you receive a diagnosis of Alzheimer's, FTD, or a related condition, you want to connect with a certified elder law attorney. And you want to cover these three areas: estate planning, identifying decision makers, and financial planning for future care needs. Estate planning after a diagnosis. I put this explanation, share your diagnosis with your attorney, because I had the experience recently of working with a caregiver who mentioned to me that she and her husband had recently updated their all of their estate plan, their will and their advance directives, but they hadn't mentioned to their attorney that her husband had received a diagnosis of Alzheimer's disease. And I thought, what a missed opportunity to make future plans with like the full picture of what the family might have to deal with in mind. So it's very important that you work with a certified elder law attorney, even if you are living with a young onset dementia. And you can find, first of all, you can find out if the attorney you're already working with is an elder law attorney by going to the National Academy of Elder Law Attorneys, NALA.org. And you can also find one local to your area. As you're making plans, doing your will, setting up your documents for who can make decisions for you, making financial plans. There are some families that even will work with more than one attorney. They'll get a second opinion. Do you think this plan will work for us, given that we may have future care needs? Know that that is fine. But what's important is that you meet early and that you're also open to the idea that you may need to update things. as your life is continued to be impacted by your diagnosis. Deciding on decision makers. So, you know that I'm presenting from Massachusetts, Mass General Hospital. And so here we have the healthcare proxy, which is the document required to have someone make medical decisions on your behalf if you cannot speak for yourself. In other parts of the country, that document may be called something else, like a medical power of attorney. But what's important is that you fill out a document that identifies a person who can make medical decisions for you if you're not able to make them for yourself. And then financial decisions. Who's going to help make decisions about the money in your bank account, about your pension if it's coming in, about your Social Security disability income? You need to identify someone who you trust who can help manage your finances. And I would say that the next step that you should take after meeting with your attorney and making these financial decisions is to go to your bank. Work with a professional at your bank. Let them know about what's going on in your family and how you want to plan to keep your finances safe. It's very important that we protect ourselves and the people that we love from financial abuse. And after a diagnosis of Alzheimer's, FTD, or a related condition, you can be more vulnerable. Okay, so you've worked on your estate plan. You've figured out, you've talked about decision makers. Now you need to do something that can be a little trickier, and that's financial planning for future care needs. You might not even know what you need to make a financial plan for because you might not even be sure, well, what are my future care options? So you want to understand your options, meaning how much would it cost if I decided I wanted to stay home through every stage of my illness? That would require talking with your physician about what would be some of the areas where I would need support. Would I need to be able to shower on the first floor? Would I need a bedroom on the first floor of my home? Will I have trouble getting up the stairs to get into my home? What about hiring round-the-clock care? How much would that cost? Would that be an environment that would be okay for my family? Sometimes we have goals of care, but they also need to align with what is our environment? Who are the people who are caring for us? And sometimes we need to be flexible. Safety always needs to come first. Functionality, right? If you don't live in a space with a handicap accessible bathroom, you'd need to make plans to renovate it or to move to a place or a facility that could accommodate your needs. So, talking with your physician about future care needs and getting some help to talk about these advanced care planning and goals of care discussions. I found a great resource at the National Institute on Aging, and I put the website on this slide. Just some starters to help families start to think about, what are advanced care planning discussions that we should have in the early stage that will help us think about financial planning for the future. And just know that you can talk with your attorney very directly about what your hopes are, and you can always make backup plans. And what's great is when you make a plan, you can go back and adjust it as your environment, your situation, your resources, and your symptoms change over time. So, what questions do we need to ask to know what type of service is right for our care situation? That goes back to connecting with your doctor. You will likely want to also read and maybe listen to webinars or podcasts. My only suggestion is I want to caution you to stay away from the midnight Google. Try to stick with trusted sources of information. The Alzheimer's Association, the Association for Frontotemporal Degeneration. If your clinic or hospital has a website, the National Institute on Aging. So only go to trusted sources for information and talk with your provider. I read this online. Is this what I should expect will happen to me given my specific diagnosis and symptoms? And then how do you find those services? We're going to talk a lot about that. And when is the right time to connect with services? Some services you want to connect right away, and others are going to be things you're going to focus on down the line. Today, we're talking about what are the services and supports you'd want to think about at the beginning of your journey. And learning the language of care. So I'll do an overview of each of these, and then we'll delve a little bit deeper. So, one of the services that many people are not aware of is that of a life care manager. These are professionals, usually social workers, who have expertise in care planning. They know a lot about what is required to support people after a diagnosis of Alzheimer's, people who are living with dementia. And they can really help you not only to build a care plan early on, but to navigate transitions in care. Like maybe your family, you're as a couple, you decide you want to move to a senior living community, but you need some guidance about how to choose the right one. Maybe as a family, you decide we need to look for memory care assisted living or skilled nursing care. And life care managers can help you to navigate those transitions. They can also be wonderful supports when you're hiring care at home, and helping to manage difficult symptoms. Adult day health programs are community-based. They're active social programs. We really love to refer families to them in our clinic because they provide respite and support for the person with the diagnosis and family caregivers. And then home care is really what it sounds like, but there's different types. So I'll go through each one of those. Okay. Please don't be overwhelmed by all the text on this slide. I know that this session is recorded. We're going to post it on our YouTube channel, and I wanted to make sure to put information here as a resource. So, thinking about, you know, what would a life care manager do for me? Well, not only can they help you with hiring staff and identifying appropriate resources, but they can really help you with those delicate transitions. So thinking about, how would we actually introduce a, a home care provider into our home? Because we want to be able to respect the dignity of the person living with the diagnosis. Life care managers can help to facilitate some of those tough family conversations, whether it's between the care partner and the person with the diagnosis, maybe around, hey, you know, driving has become really challenging. And so we've actually hired a driver to help bring you to the gym every week, to help you so that you can volunteer at the senior center, who's going to bring you to church once a week so that you can enjoy mass. And I think that having a life care manager can also be helpful when you have those tough family conversations between family members who are outside of that immediate person with a diagnosis and caregiver dyad. We know that sometimes the people that are primary caregivers can have a different understanding or different needs about when it's time to engage services than maybe long distance caregivers. Life care managers can also be critically helpful when a person living with a diagnosis does not have a care partner at all or does not have a care partner that lives with them in their home. So you can go to the Aging Life Care Association at aginglifecare.org, and connect with a life care manager. Many people ask, well, how do you pay for life care management services? It's private pay most of the time. Um, Long-term care insurance can potentially help defray the cost. And sometimes there can also be grants or small supports in your community that could help you to defray the cost of working with a life care manager. While there is a cost to working with someone to help connect you with resources, I found it to be a truly valuable resource because families stress so much trying to become experts in a care world that maybe they had no knowledge of before. So sometimes, especially at those early stages, just having an expert guide can make the process feel so much less stressful. Okay. So, adult day health programs. These are community-based programs designed to provide care and services for adults who need assistance or supervision during the day. In a lot of ways, people think of this as daycare. And what we want to make sure is to infuse dignity, respect, and personhood into every experience that people have while living with dementia. Adult day health programs are active social programs where you're likely going to connect with people in your local community. They're wonderfully caring environments where you have the opportunity not only to engage in cognitively appropriate curriculum, potentially take advantage of therapy. I know many adult day health programs where speech therapists, occupational therapists, and physical therapists will go to the center to offer those services to people who are medically eligible for them. Some adult day health programs have nurses on staff. They can assist with medication management, meals, transportation to and from. But the thing that they can really provide is friendship, community connection, reducing those feelings of isolation and loneliness. And we can't say enough about how important that is. Many families will start by using adult day health programs to support the caregiver's ability to have respite, to take a break, to do some things for self-care, such as going to their own doctor's appointments or filling out paperwork that needs to be done to manage their loved one's care and affairs. But it can also be just a safe and supervised ways that care partners can go to work and make sure that their loved one isn't staying home alone. Even if they might be okay, they might start to get lonely. They might feel more depressed. They might feel, less able to engage in conversation. Adult day health programs often have robust music, art, and different activities. And so I would encourage you to find the local adult day health program near you. You can do this by calling the Alzheimer's Association 24/7 helpline. I've listed it below and we'll talk about it again. This is honestly the quickest and easiest way to find out about local programs in your area. So, how do you pay for an adult day health program? You could private pay. Long-term care insurance could cover it. The PACE program. This is something that you would want to find out, is this available in my community? Do I meet the income eligibility to be a part of PACE? And the Veterans Administration. For years, they've had a benefit where they support veterans with disabilities attending adult day health programs. And so there are many different ways to pay for the program. And in fact, if you're not sure, what support would I be eligible for? How could I pay for this? How many days can my loved one attend? Go and visit your local adult day health program. Check it out. Talk to the staff there. See who they're caring for. Have an open mind that you and your loved one could benefit from the care and support of a community-based program, because you may find that it gives you that respite that you need during the day so that you can provide most of your care and stay in your home for longer. Home care. Home care is a big one, and it's honestly something that is so important to help people with transitions. Often, home care can be the very first service that people engage with. Home care aims to help individuals living with dementia maintain their independence and quality of life while receiving necessary care and support in their home and community. So, home care can often start with companion care. So, what is companion care? Well, this could be when maybe the person living with a diagnosis, they don't need help for personal care, meaning they don't need help in the bathroom, they don't need help getting dressed, they don't need help eating, but they might need help. Maybe they're no longer driving. They could go to the grocery store, but they might need a lot of help following their list and getting through the aisles. Maybe they want to engage in activities at the local senior center, but they're not able to really follow along with conversation as quickly as they used to, or they need a little bit of support to help with um, engaging in the, card games that people are playing. The other thing about companion care is it can also open the door for real community engagement. For example, I have been a caregiver for my dad who's living with Alzheimer's disease. And early in the course of his illness, I was seeking volunteer opportunities for him. Dad had worked in retail for many years, and I knew that he would be a great volunteer at the food pantry, except for one major issue. Dad didn't know the date, and he couldn't keep current with the date, so that meant he wasn't good at checking the expiration labels on the donated food. But when I hired a companion who picked him up, went with him to the food pantry, and they worked as a team, Dad was able to contribute to the community, to give back, to have meaning and purpose, and to do it in a way that was safe and helpful to the organization that he was supporting. So companion care can really start with what really looks like friendship. And then as people progress, they may need more help. And that can come from home care that is from a certified nursing assistant. Somebody who is trained to administer medications, help out with toileting, support someone as they shower and bathe, all aspects of personal care. These are different types of care, and you'd want to connect with a home care agency to find out what type of care do they offer. We've actually had members of our caregiver support group that have had great luck on care.com, hiring companions and home health aides. Word of mouth can also be a great way to find amazing home health aides and companions. So talk with people at your local senior center. Go to your faith community and find out if somebody had hired someone else to care for a loved one. So don't be afraid to engage that network of your community to find out, where can I find someone who can help and provide this loving care and support while I need to do other things? And how do you pay for it? Private pay, of course, is an option. Long-term care insurance can help defray the cost. The Veterans Administration can help to support it, and the PACE program. This slide is just dedicated to the Alzheimer's Association because it is so incredible, the opportunities to act as a resource finder. So you can call the 24/7, 365 day a year helpline at 1-800-272-3900 and say exactly what you're looking for. Hi, I'm a caregiver for my husband who's living with Alzheimer's, and I want to hire a home health aide. Can you help me identify who are the local home care agencies in my zip code and within a 10-mile radius? And that's all you have to do. And then they'll email you the list so that you can reach out and make some phone calls. But it can really be a wonderful way to get access to resources. I made a little mock sheet. Like thinking about care planning, you always want the ability to take notes. So document the resources in your area. If you find something great that you're going to use now, or maybe you're going to use later, set up a notepad, set up an Excel spreadsheet, make a document where you're identifying contact information, what this resource can help you with, and maybe take notes along the way. So now let's talk about how we can build connections with agencies for care and support in our community. The area agencies on aging. This is actually a really important resource that we want to make sure everyone is taking advantage of. And it doesn't matter how old you are. If you have a diagnosis of Alzheimer's disease or related dementia, you want to call your local area agency on aging to find out when you can get an evaluation in your home to find out what services and supports your family might be eligible for. So, they're AAAs, as they're often referred to, are programs that provide a range of services for older adults, adults with disabilities, family caregivers, and residents in long-term care facilities. And they can include things like a home safety evaluation, resource referral, nutrition programs like Meals on Wheels, medical equipment, home care, like home health aides that come to your home, caregiver support, and insurance counseling, like navigating, oh, now I'm on Medicare. What does that mean? You can get some guidance. And if you've never heard of a AAA or an area agency on aging, that's because there's likely a community agency close to you that is designated as your local area agency on aging. So all you have to do is go to eldercare.acl.gov and put your zip code in, and that will identify who your local agency is. You want to invite them to come in and do an evaluation for your family as early as you feel comfortable because they'll let you know what services and supports you're immediately eligible for. And most of the time, those services and supports are offered on a sliding fee scale. So you can figure out what's affordable, what works for our family. Okay, we've identified that we have supports in this area, but maybe we still need to get some additional ones. And you can ask for referrals for other resources. It's a great connection to make. They often know all the providers in the area, and you'll often find that it'll be a resource you'll go back to again and again throughout your journey of life lived alongside dementia. Memory cafes. We want to make sure that we're including just places for connection and joy and some fun along the way. Memory cafes are welcoming social gatherings for people living with changes in their memory or thinking and the people who care about them. A memory cafe is a place to have fun together, talk with others who understand what you're going through, and try something new. Memory cafes often have programs, maybe once or twice a month. They're usually a couple of hours in length, and they offer things like social time, friendship, education, music and art. Music and art are a big element. Maybe sometimes animal assisted therapy, nutrition. There'll be like snacks or a lunch, respite. Sometimes at the memory cafe, even though the caregiver might bring the person living with the diagnosis, there could be time where they'll split off. Maybe persons with a diagnosis are doing some art with some memory cafe volunteers, and then that gives the caregivers time to have a cup of coffee and talk with each other. And it's a place to meet people in your local community who are going through what you're going through. It's a positive, supportive environment. Massachusetts has many memory cafes, but you can find them all across the United States. So you want to go online and look at the Dementia Friendly America Memory Cafe Locator, and I've listed the website here. And I would recommend anyone to go and check out a memory cafe. And also for caregivers, here's a little tip. If you're thinking about, well, I'd love to hire a companion to hang out with my loved one, but I don't know what they would do or where they would go, a memory cafe is a perfect activity. So if you hire a companion to spend time, they can be the one that can provide the transportation and the support and engage at the memory cafe. And they really are just wonderful programs. Support group. It's not just feelings. So I put this title on because I've talked with many caregivers that say to me, I really don't want to go to a support group because I don't want to sit in a circle and cry or talk about my feelings. I have benefited from attending a support group as a family caregiver, and I've been honored to co-facilitate caregiver support groups for 13 years. And what I found is they are just incredible places to connect with resources, to get real tools to navigate life after a diagnosis, to learn tips and tricks to how to manage the difficult symptoms that Alzheimer's and FTD can present. So When should you go to a support group? It's always the right time. Literally any time along your journey, you can go to support group. So you can go right after a diagnosis to become connected. You could show up during times of transition. Like, you know what? I'm really feeling like we might need to think about memory care, and I don't know how I feel about it or where to find a good one. And then you could go to support group and talk with others who likely have had that experience. Oftentimes, family caregivers show up at support group because they need help managing challenging symptoms. Of course, you're going to talk to your doctor if you're managing challenging symptoms, but oftentimes, just looking at the symptom through the medical lens is not enough. So you need that medical lens, but you also need the hands-on behavioral approach that a support group can give you. You need tips and tricks on how to modify your environment that a support group could give you. And it's important for both the person living with the diagnosis and the caregiver to know that in support group, they can get help to manage feelings of grief and loss at every stage of the journey. So where can you find these amazing groups, which are often free, by the way? The easiest place to find them is go on to the website for your diagnosis. So if you've been diagnosed with Alzheimer's disease, go to alz.org. If you've been diagnosed with FTD or primary progressive aphasia, PPA, you want to go to the Association for Frontal Temporal Degeneration. If you have Lewy body dementia, you want to go there. Your local senior center may offer a support group. Local hospitals and senior living communities, even public libraries. So just, take a look around. Ask your area agency on aging, your AAA. Do you know where there are support groups for caregivers or for people living with the diagnosis? And they can usually point you in the right direction. Keep in mind, there are different types of groups. There are groups where you can go together. So it could be the person with the diagnosis and their care partner. There are groups just for caregivers. There are groups just for people with the diagnosis. There's spouse partner, caregiver groups. There's adult child groups. There's even different affinity groups depending on, how do you most identify? Like LGBTQIA plus groups, which, might be so important because you're navigating all these new normals after a diagnosis. And so being in a support group with others who have a shared experience with you could be really important. I wanted to highlight a special resource for support groups for young onset families, and that's Lorenzo's House. Lorenzo's House, you can find at lorenzoshouse.org. And that's a place where you can go if a child needs support because they have a parent that has a young onset dementia, where a spouse can go and connect in a support group with other spouses who are living with young onset dementia. And this is sometimes people diagnosed in their 30s, 40s, or 50s with Alzheimer's or related dementia. It's really important. I would love every caregiver to say that in 2025, they're going to commit to connecting with just one support group. Support groups meet in person, they meet online, they're usually free, and sometimes they meet on an ongoing basis, and other times they meet for short periods of time. But just be open to checking out how a support group can help you. Plan ahead. We want to make sure that all of our caregivers are not the only caregiver. By putting a plan B, a backup plan, in place, you're recognizing your own needs and protecting your loved ones' care and comfort. So here are some examples of Plan B for caregivers. And I really have to give all the kudos to caregivers in our Boston area FTD caregiver support group because they talked about how some of them have these actual plans in place. One caregiver talked about daily check-ins. He had created a contact team, a group text, because he had had a fall in his home. And he thought about, well, gee, if my wife isn't able to help me after a fall, how long would I be incapacitated until someone noticed, until someone could reach out for help? So, setting up daily check-ins, whether by text or phone call, can be really helpful. So, what you want to do is identify who's going to be on your contact team. Ask them, could you send me a text in the morning and just to check in on me, and I will like it or give it a check mark. It doesn't have to be a long engagement, like defining that method, text or phone. Define the clear times, like in the morning or in the evening, and then set the boundaries. What happens if there's no response? What's the plan? So does that mean that someone, if it's a by text message and they get no response, do they then make a phone call? And if there's no response, do they go over to the house? Do these members of your contact team have a key so that they can come into your home? Maybe the people who are on your contact team don't live close by, but if they don't hear from you on text and they don't hear from you by phone, then they're going to ask a neighbor or potentially call the local police department in your community and ask them to do a safety check on you. So setting up those daily check-ins. Planned respite. This is critical. And I want to emphasize this phrase, routine respite, meaning weekly attendance at a yoga or fitness class, monthly attendance with your mental health provider, maybe a weekend getaway with friends once a quarter or every 6 months. Planned trip for a special event. You want to go to your daughter's wedding that's across the country. Maybe you need to get your knee replaced, and so you have to schedule a surgery or a medical procedure. So you want to figure out who are the people that I can call on to provide that coverage. And if you don't have a family member or friend who can do it, what agency can you work with? And this is where maybe employing the services of a life care manager can help you to set up those services and supports so you have routine respite. And then emergency support. What would happen if, your loved one who's living in the early stages of Alzheimer's was home alone and you were at the grocery store and on the way home you got in a car accident and you had to go to the hospital? Who would communicate with your loved one at home that something had happened? Who would check in on them? Who would potentially drive them to the hospital to check on you? What if in the later stages, something were to happen medically to you at home? You would have a fall or a heart attack and need to go to the hospital in an emergency scenario. Who would stay with your loved one? You want to identify local backup for fast response. So maybe you have a wonderful adult daughter who can come and step in as a caregiver, but she lives 2 hours away. Do you have a neighbor who could just come over quickly and hang out while she's driving over? And you want to think a lot about who can be your backup in off hours, meaning 2 in the morning, Sunday afternoon, who's around to provide that support. So tell yourself that you're going to take an action item to make a plan B, to care for the caregiver, because caring for yourself, setting up that backup plan is truly a way to protect your loved one and protect their comfort and their needs. So action items could be set up a group text, make it fun, schedule coverage for routine respite. And when you identify who those emergency backup people are, make an emergency sheet for them with like basic information about your loved ones so that they just have contact information for medical providers, maybe any relevant allergies or medications, just, giving them a little bit of information so they can provide that high level care. Don't forget, love is on the list. As we're making these backup plans and talking about care planning in general, don't forget that there are so many people who love you who just want to help you. And maybe they don't feel like they can help you with dementia caregiving. Maybe they don't feel equipped. But now that dementia has come into your life, maybe other things have changed. Like you no longer have the time to mow your lawn. You would love it if someone would drop off a lasagna at your house once a month. Maybe it'd be really nice if someone just popped over to have a cup of coffee just to chat and provide that social support. So make a list of things that people who want to give you that love and care and connection can do for you. Consider keeping it on your phone so that when you see that friend at the grocery store and they say, Let me know if you need anything. You can take your phone out and you can text them the list right away and say, if there's anything on this list that you'd want to do, it would help me so much. People love that. They want to connect with you. And you don't know how much you might be helping them by really offering ways that they can support you. So, what are the key takeaways for the first module of the home community? One, we want to make sure that after a diagnosis, you're documenting your goals of care and connecting with legal and financial experts, preferably a certified elder law attorney. You're making those backup plans. Make a plan B for respite care that's both routine, like when are you going out for walks? When are you going to yoga? When do you see your mental health provider? And also for those big, emergencies that we hope will never happen. And then reach out for care and support. It is never too early. Consider sharing what's going on with the people who love you and are close to you in your life. Consider signing up for a support group. Go to a webinar like this one and know that there's a whole community of people out there ready to care for you along this journey. I'd like to thank my amazing team in the MGH FTD unit and to the donors who support programs like this and make them possible. Learn more about the work of our clinical research program, ftdboston.org. You can follow us on Instagram at ftdboston and send me an email if you have a question at catherine.brandt@mgh.harvard.edu. Thank you so much. Hi, Amy.
Hi, Katie. Thank you once again for another really educational and entertaining webinar about, the first steps to take along that dementia journey.
Yes.
I think I have some questions. You know, s- we talk about you talked at the beginning of the webinar about um, preparing legal or revising legal documents. Is this something just that should be done just for the person with the diagnosis, or should the care partner be doing it as well?
Oh my gosh, that's an excellent question, and both people need to do it. So, especially when you think about couples, right? So often you have a husband and a wife, or a wife and a wife who need to think about their estate planning and their documents. Well, oftentimes they are each other's healthcare proxy, they're each other's decision makers. So now, unfortunately, if your decision maker has been diagnosed with Alzheimer's or related dementia, you need to identify someone new so you can no longer be each other's decision makers.
I mean, that really it really brought home that situation when you were talking about the emergency plans at towards the end of the talk today. You presented several ways for a person with a diagnosis to be engaged and active. However, you and I have seen and heard so many times in support group that caregivers say, "Oh, my loved one wouldn't like that," or "My loved one wouldn't do that." How do we get a person with a diagnosis to engage, put them with a diagnosis to engage in these programs that you're talking about?
So many people come to support group. Like I think every week I have a caregiver that says to me, "Oh, my loved one wouldn't do that." You know, I think a couple things. One, it matters how it's presented. So let's talk about that. So let's say that I have to go to work. And I'm starting to feel like my loved one isn't doing well. They burned a bunch of things in the microwave. I noticed that they didn't change their clothes all day. The TV was on, and they were in a bad mood when I came home. So I need someone to come over and spend time with them. Well, maybe you say to them, you know what? I don't feel like you're doing so great while I'm at work, so I need to hire someone to come over and watch you. That is going to be received so terribly. Because think about how you would feel. What do you mean I'm doing terrible? I didn't know that. Another way to present it is, hey, did you hear? Paul is retired and he's looking to do some volunteer work and he heard you're not working. He said he can pick you up. So he's going to start coming over here at 9 a.m. every morning. And don't worry, if you're not dressed, Paul will remind you to get dressed. And you guys are going to go out together. And boy, the senior center, the library, the church, they really need your help and they're looking forward to seeing you.
We recently had a caregiver in our support group who hired a companion for their loved one, their husband, and the husband didn't was not at all happy about it until the and one of the things that the husband loved to do was their grocery shopping. When the companion said, "I can take you to your favorite grocery store," well, that sealed the deal. And then more of a, something, a beautiful relationship was begun. So I think, you're right that you have to, respect the personhood and know what, know what your loved one's interests are and the ways that, the little sparks that will get them to participate.
I had a companion I hired for my dad for I think like 5 years. And he'd been a companion for years for other people. And he said I was the first one to set them up with a volunteer activity. They would volunteer at the food pantry. And they made friends with all the other food pantry volunteers. They started going to the annual celebration luncheon. They would go out on food drives. They would have like little coffee parties. And he said that it brought a lot of joy to his life. And he thanked me for connecting him with this community of volunteers. So, I think a lot about all the ways that my dad continued to give back to his community after his diagnosis.
That's amazing. Um, you mentioned several programs, and unfortunately, it looked like there was a lot of stuff that was private pay.
Yeah.
How do families, deal with this?
Yeah. So I think, first of all, this is where, we need to talk about the legal and financial planning. And I love something that one of the attorneys that we worked with, said it's never too late to plan for care. So there's always something that can be done. And you want to meet with attorneys who are familiar with what are the types of services and how much do they cost to help you make those financial decisions. Now, you can always talk with the program directly. So saying, I'm really having trouble affording this adult day health program. Do you have any grants or scholarships? Your local town hall might offer a grant or a scholarship. I've found some area agencies on aging know about local awards. You can even apply for respite grants through private organizations like Hilarity for Charity, which was started by Seth Rogen and Lauren Miller Rogen in response to losing a loved one to Alzheimer's disease. The Association for Frontal Temporal Degeneration offers small grants to offset the cost of care. And I wish that it were easier because everything that I just mentioned is like another application to fill out. But, we talked about that love is on the list, and there might be people in your life who reach out and say, "We want to help. Let us know if you need something." You might say to them, adult day health is really expensive. And if you ever wanted to contribute, or if you wanted to contribute to having a companion come over once a month, that would really help me a lot.
And I just wanted to add about AFTD's respite grants. They provide grants for both the caregiver and the person with the diagnosis to improve the quality of life of the person with the diagnosis. So, your family could potentially get two grants there.
Yeah, yeah.
You mentioned several times that the Veterans Administration might be able to help pay for some of these programs. How can families get connected to the VA and find out if they would be eligible?
Yes. So if you or your loved one is a veteran, you want to go to your local VA medical center. So just go to va.gov and find out where is your local center. You want to contact them and say, so let's say you are the person who's the veteran. If you've never received care through the Veterans Administration medical system before, that's okay. You can always sign up at any time. And what's usually required is you have to establish that you have a primary care physician within the VA system. But the good news is you don't have to give up your outside primary care physician. So let's say you have a PCP that you love for 25 years, you can keep them. You add the VA one. Now, maybe you're not the person who was maybe the caregiver is the spouse. You should still reach out to the VA and say, I am a caregiver for a veteran who's living with dementia. What resources are available to me? And, you'd be very surprised to find out what they are.
You mentioned your own experience with your dad and how he's been able to give back. What do you think is something that people might be surprised to experience when they use any of these services that we discussed today?
I think they'd be surprised to experience the fun, the joy, the new friendships. I think people just think of it all as like, oh, it's awful. Now I'm going to have to go to adult daycare. And then they walk into a place and people are smiling and people are excited to see you. And, maybe you're giving back. You're making someone else's day by showing up. People form real relationships, whether they're home care providers, memory cafe, volunteers. And I think that for me personally, as a family caregiver, I didn't realize the real love and friendship I would experience by engaging with these community-based agencies.
Well, thank you. We'll be back on in June for
That's
our third
right.
episode. And until then, you'll be able to watch the first two modules on the MGH FTD Unit YouTube page.
This has been a great experience. And Amy, thanks for coming along and always, adding to the discussion. I just love working together.
Thank you.